Hello and welcome back to your Emergency Medical Responder Program. This is Chapter 8. We're going to cover professional rescue or CPR on this particular chapter. So let's get started. All right, so cardiopulmonary resuscitation. What does that mean? When do we do it? Those kind of things. That's what we're going to cover in this particular chapter. Cardiopulmonary resuscitation contains three components, or consists of three components: circulation, which is C, airway, which is A, and breathing, which is B. If you'll remember in the airway module, we talked about A and B, and we touched a little bit about on C. But airway and breathing skills may be a life-saving for a patient whose heart is still beating. So even if you don't need to do the actual compressions of cardiopulmonary resuscitation, you may just have to breathe for them. In most cases, the patient's heart has also stopped beating as well. So rescue breathing alone will not save these particular types of patients. The circulatory system must function in a manner which it can carry oxygen to the body. So if it's not beating, it's not providing the oxygen to the cells that are necessary for life. All right, so to maintain or restore circulation manually, we're going to be performing cardiac compressions, or what we also call closed chest cardiac massage. This is going to be maintaining also both breathing and the heartbeat through rescue breathing, and also chest compressions must be done together. Approximately 70% of the patients who experience cardiac arrest are in a state of ventricular fibrillation. In this condition, the heart muscle is quivering and not effectively pumping blood. So therefore, we integrate with our CPR a automatic external defibrillator, or AED, which can help these patients. All right, so anatomy and function of the circulatory system. So the circulatory system consists of the pump, which is the heart, a network of pipes, which we call blood vessels, and then also the fluid, or the blood. The heart, which is about the size of your fist, is located in the chest between the lungs. The heart consists of 4 chambers, 2 on the right side and 2 on the left side. Each upper chamber in the heart is called the atriums. The right atrium receives blood from the veins of the body. The left atrium receives highly oxygenated blood from the lungs. Each lower chamber is called a ventricle. The right ventricle pumps deoxygenated blood into the lungs, and the left ventricle pumps highly oxygenated blood throughout the body. The 4 chambers of the heart work in well-ordered sequence to pump blood to the lungs and to the rest of the body. One-way valves in the heart and veins allow for blood to flow only in one direction through the circulatory system. All right, so here's some good diagrams of the heart. It gives you a good idea of how they function. I really like this one over here because this particular one shows you how the unoxygenated blood, and notice how that these veins, okay, these are the vena cava, this is the inferior vena cava, and this is the superior vena cava, okay? Notice how the blood comes in from both of those vessels, okay? You have the superior, which is bringing the unoxygenated blood from your arms and from also your head down into the right atrium, and then the blood is coming up from the lower vena cava, or the inferior vena cava, into the right atrium, and that's coming from the lower legs and the lower parts of the body. They come into that right atrium, and it pushes it right down into the right ventricle. And then that right ventricle sends it this way, okay, right up into the lungs for it to be oxygenated, okay? And then from the lungs, once it's received its oxygenation and got rid of its carbon dioxide, it comes back into the left atrium, as you can see right here, left atrium. You can see it coming in. There you go. It comes into that left atrium and is pushed down into the left ventricle. And then the left ventricle pushes it up through the aorta, and it goes out to the body where it needs to go. And that cycle repeats itself over and over again, anywhere between 80 to 100 times a minute. All right, that's it. It's that simple. It's not that difficult. Okay, so let's go to the next slide. All right, so the arteries carry blood away from the heart at high pressure. Therefore, the walls of the arteries are thick. Smaller arteries eventually branch into the capillaries, which are the smallest pipes in the circulatory systems. Veins are thin-walled pipes of the circulatory system that carry blood back to the heart. Right, there are four major artery locations: the neck, which is the carotid artery, the wrist, which is the radial artery, the arm, which is the brachial artery, the groin, which is the femoral arteries, and then because these arteries lie between bony structures in the skin, you can use them to measure the patient's pulse. A pulse is generated when the heart contracts and sends a pressure wave through the artery. That's why you can feel it. Okay, so in these figures, you can see the locations of where you're feeling for the pulse. This is the carotid here. This is the radius here. This is the brachial. And then this is the femoral. So these are all locations that you're looking for, or you're feeling for the pulsation of that pressure against the arteries, or the wave, the pressure wave that's being caused by when the heart contracts. And this is where you're going to feel the pulse at. All right, so blood has several components. It has plasma. It has red blood cells. The red blood cells carry oxygen from the lungs to the body and brings carbon dioxide back to the lungs. The plasma, just to kind of touch base on that, I think we mentioned that in the human anatomy section. It is the water, okay? It's the water that's between the cells. And then white blood cells, they devour bacteria and other disease-causing organisms and gets rid of them appropriately. It's our fighting mechanism, our little sentinels that are inside of our body to try to make sure that we don't get sick. And then platelets, they start the blood clotting process. All right, so these are the components of blood. As you can see, plasma, this is all of the water, okay? It's about 55%, okay? Platelets equals clotting, red blood cells equals carrying oxygen, white blood cells, are for infection fighting. So it's about 45%, okay? So blood cells about 45%, plasma about 55%. Right, so cardiac arrest occurs when the heart stops contracting and no blood is pumped through the blood vessels. Without a supply of blood, the cells in the bodies will die because they cannot get oxygen and nutrients, and they cannot eliminate waste products. Some organs are more sensitive to low oxygen levels than others. Brain damage begins about 4 to 6 minutes after cardiac arrest. Within 8 to 10 minutes, the damage in the brain may become irreversible. That's why we do CPR. We want to get to them right away. We want to get to them before this 4 to 6 minutes. So hopefully you as the first responder arrives within the first couple of minutes and can start doing CPR. Right, so causes of cardiac arrest, there's several. The heart and blood vessels may have disease that ends up causing a heart attack or a stroke. You may have respiratory arrest. If untreated, it'll go into cardiac arrest. Medical emergencies such as epilepsy, diabetes, allergic reactions, electrical shocks, and poisonings. Also drug overdoses. Unfortunately, we have many, many drugs out there that people are experimenting with, and unfortunately, they're dying from it. So that can be a cause of cardiac arrest. Drowning, suffocation, trauma, and also shock caused by massive blood loss. Right, so a patient who has experienced a cardiac arrest is unconscious and is not breathing. You cannot feel a pulse and the patient looks dead. Regardless of the cause, the initial treatment is the same. Provide CPR. All right, so CPR requires 3 types of skills. C for circulation, A for airway, and B for breathing. Airway and breathing skills, the airway management chapter addressed how to determine if the airway is open, how to correct a block airway by using the head tilt, chin lift, or jaw thrust maneuvers. Y'all remember that. And then also how to correct the absence of breathing by perform rescue breathing. So we covered that already in the airway chapter. Okay, so remember what we did back then. Go back and review as necessary. All right, so to perform CPR, you must combine the airway and breathing skills with circulation skills. So check for a patient's pulse. That's the C part. If there is no pulse, correct the patient's circulation by performing external chest compressions. By compressing the patient's sternum, you will change the pressure in the patient's chest and force enough blood through the system to sustain life for a short period of time. All right, so CPR by itself cannot sustain life indefinitely. Once it is recognized that the patient is pulseless and not breathing, CPR should be started as soon as possible to give the patient the best chance for survival. Many patients will need defibrillation and medication to be successfully resuscitated from cardiac arrest. Okay, so the links of the chain of survival, they include the following. Again, like we talked about, CPR alone is not sufficient to save lives, but it is the first treatment in the American Heart Association's chain of survival. The links of the chain of survival include recognition of cardiac arrest, activation of the emergency response system. So as soon as you recognize that the person is in cardiac arrest, you must call 911. Immediate CPR with the emphasis on high-quality chest compressions, rapid defibrillation, and both basic and advanced emergency medical services care, advanced life support, and post-arrest care. As an EMR, you can help the patient by providing early CPR with an emphasis on high-quality chest compressions and by making sure that the EMS system has been activated. The chain of survival is only as good as its weakest link. All right, so these are the 5 links of the cardiac chain of survival. Here are recognition and activation of EMS. That needs to happen immediately. And then high quality CPR. And notice how I said high quality CPR. It needs to be effective. Rapid defibrillation, basic and advanced EMS, and then ACLS and post-arrest care. All right, so when to start CPR? CPR should be started on all non-breathing pulseless patients, unless they're obviously dead or they have a do not resuscitate order that is valid in your jurisdiction. The following criteria are reliable signs of death and indicate that CPR should not be started. If they're decapitated, this occurs when the head has been separated from the rest of the body. If there is obviously no chance of saving the patient, if the patient is split in multiple pieces, there's no chance of saving that patient. Rigor mortis. This is a temporary stiffening of the muscles that occurs several hours after death. It indicates that the patient has been dead for a prolonged period of time and cannot be resuscitated. All right, continued on. Also, if there's evidence of tissue decomposition, if there's actual decay of the flesh, this only occurs after the person's been dead for more than a day. And then also dependent lividity. Dependent lividity is red or purple coloration that occurs on the parts of the patient's body that are closest to the ground. It is caused by blood seeping into the tissues on dependent or lower or part of the person's body. Okay, so whatever's the lowest part of the patient's body, such as their back, the back of their legs, the back of their neck, those kind of things, you'll see this discoloration there. This occurs after a person's been dead for several hours. It is better to start CPR on a patient who is later declared dead or than to withhold CPR from a patient who might have been saved. All right, so when to stop CPR? Discontinue CPR only when effective spontaneous circulation and ventilation are restored or the patient begins to move. Resuscitation efforts that are transferred over to another person with an equal or a higher level of training who continues the CPR. A physician orders you to stop. A patient is transferred to a properly trained EMS personnel. This is when we discontinue CPR. Continue on. Reliable criteria for death as previously listed are recognized. Or finally, you are too exhausted to continue resuscitation. Environmental hazards endanger your safety, or continued resuscitation would place the lives of others at risk. All right, so external cardiac compressions. An adult patient in cardiac arrest is unconscious and has no carotid pulse and is not breathing or only gasping. Check for circulation by feeling the carotid pulse. Remember, that's the one up here in the neck. Okay, feel for a pulse and look to see that they have no breathing or only gasping. Okay, because gasping is not a sign of life. If they're just kind of making these gasping noises, you're still going to need to do CPR on them. It is not an adequate sign of life. To check the carotid pulse, place your index and middle finger, okay, on the larynx right here. Everybody see? Right here, okay? Now slide your fingers into the groove between the larynx and the muscles at the side of the neck. Keep your fingers there for at least 5 seconds, but no more than 10 seconds. So 1, 1,000, 2, 1,000, 3, 1,000, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000. Okay, we've held it there long enough. Don't go more than 10 seconds to be sure that the pulse is absent and not just slow. If there is no carotid pulse in an unresponsive patient, you're going to begin chest compressions. The patient must be placed on a firm horizontal surface. Stand or kneel beside the patient's chest and face the patient. Place the heel of one hand, this part right here, okay, the heel of one hand in the center of the patient's chest on the lower half of the sternum, and place the heel of the other hand on top and interlock your fingers. And then you're going to learn these on your steps on how to perform those adult chest compressions on skill drill 8-1. We will also practice them during your skills assessment. All right, so next, external chest compressions on an infant. Infants and children younger than 1 year of age, or infants period, which is a child younger than 1 year, who have experienced cardiac arrest will be unconscious and will not be breathing or only gasping, and will have no brachial pulse. Notice that we are feeling the brachial pulse. See here, guys? Your index finger and your middle finger are feeling for the brachial pulse, okay? That's that area right there. So you need to check it from there. You must begin chest compressions if you do not feel a pulse. So you're going to use your 2 middle fingers to compress the sternum. As you can see here, 2 middle fingers. All right, now this child is alive. This is just a demonstration. Okay, this child is actually moving. But notice how the person is cradling, the first responder is cradling this infant. Okay, holding the head with his hand. Okay, and then the rest of the body is laying on the arm, and the 2 legs here and here are on each side of the arm. Okay, and then his fingers, as you can see right there. So use those 2 middle fingers to compress the sternum. You're going to compress the sternum at least 1/3 of the depths of the chest, which is approximately 1 1/2 inches. Compress at a rate of 100 to 100 times per minute. If you're the only rescuer, give 2 rescue breaths after every 30 compressions. So 30 compressions, 2 ventilations. 30 compressions, 2 ventilations. If 2 rescuers are present, give 2 rescue breaths after every 15 chest compressions. So if there's 2 of you, all right, 2 of you, all right, it's 15 to 2. If you're by yourself or single rescuer, it's 30 to 2. All right, place the infant on a solid surface or cradle infant in your arm. Whatever works for you, whatever is best. Some people aren't comfortable with this kind of position right here, okay? Some people rather lay him on a table, all right, which is fine. That's fine. Whatever works, table, bassinet, whatever's working for you. You just need to be able to perform chest compressions and ventilations. All right, so you will not need to use much force, okay, because infants are so small that their chests are very, very pliable. All right, so external chest compressions on a child. So now we've moved from an infant and we've gone to a child. You got to have signs of cardiac arrest, okay, in a child from 1 year to the onset of puberty, okay, which is somewhere between the ages of 8 and 14, depending on how big they get. So you're going to look at the first signs of puberty. So the chest compressions, they are the same thing, okay, for an adult. Check for carotid pulse to perform chest compressions. In smaller children, you might want to have to use just the heel of one hand. You don't have to double up with both hands. You can just use the heel of one hand. If they're bigger, you can use both hands on the lower half of the sternum. In larger children, perform chest compressions with two hands, same as with an adult. Compress the sternum at least 1/3 the depth of the chest, or about 2 inches. So it's 2 inches for the adults and 2 inches for the children, or for a child. Compress the chest at a rate of at least 100 to 120 times per minute. If you're the only rescuer, give 2 breaths after every 30 chest compressions. Again, if 2 rescuers are present, you'll give 2 rescue breaths and 15 compressions. So with 1 person, 30 compressions, 2 breaths. If there's 2 people, 15 compressions, 2 breaths. All right, so adult CPR. 1 rescuer adult CPR. This is providing chest compressions. Open the airway. Okay, so you got to have 3 skill sets. This is a skill drill 8-2. You're going to provide those chest compressions, open the airway, provide rescue breaths. If you were the only trained person at the scene, you must perform 1 rescuer CPR. So follow the steps in skill drill 8-2. When performing 1 rescuer CPR, you must deliver chest compressions and rescue breathing at a ratio of 30 compressions and 2 breaths. Remember, it's just like a child. Okay? Child when you're by yourself. Okay? Anybody that you're by yourself. Infant when you're by yourself. Child when you're by yourself. Adults when you're by yourself. 30 compressions, 2 ventilations. Okay? All right, so with 2 rescue adult CPR, to avoid fatigue, you need to switch off, quite often. 1 rescuer can deliver chest compressions and the other performs rescue breathing. Chest compressions and ventilations can be given more regularly and without interruption. Again, like I mentioned earlier, to avoid rescuer fatigue, the 2 rescuers should switch roles every 5 cycles of CPR. CPR should not be interrupted for more than 10 seconds. If possible, position yourselves on the opposite side of the patient, 1 near the head and 1 near the chest. You'll be following skill drill 8-3 when you do your skills on this. Switching CPR positions. This is when you switch, from one person's doing the compressions and the other person's doing the ventilations, and you switch. A switch allows the person giving compression to rest his or her arms. Switching positions should be accomplished as smoothly and as quickly as possible to minimize the break in the rate of regularity of compressions and ventilations. One method of switching the positions is as follows. As the rescuer 2 tires, he or she says out loud, instead of counting, "We will switch this time." After 25 more chest compressions, rescuer 1 completes the 2 ventilation and then moves to the chest to start performing compressions. Rescuer 2 moves to the head of the patient to maintain the airway and ventilations. Rescuer 1 then begins the chest compressions. Switching is so much easier if the rescuers work on the opposite sides of the patients. All right, so 1 rescuer infant CPR. 1 rescuer infant CPR is the principle of CPR. They're the same as adults and infants, but slightly different in technique used. Follow the steps and skills performing 1 rescuer infant CPR. Position the infant face up on a firm, flat surface. Establish a level of responsiveness. Call for additional help if the patient is unconscious. Check the brachial pulse, remember that, and check for signs of no breathing or only gasping. If the infant has no pulse and is not breathing or gasping, begin chest compressions. Compress the chest 30 times with the pads of your fingertips at the rate of 100 to 120 compressions per minute. Then give 2 breaths. If you are alone, continue to give 30 compressions followed by 2 rescue breaths until other providers arrive or until the infant begins to move. 2 rescuer infant CPR, slightly different. You can use the 2 thumbs encircling hands technique for chest compressions. It's where you're going to place both thumbs side by side over the lower half of the infant's sternum and encircle the infant's chest with your hands. Compress the sternum at the rate of 100 to 120 compressions per minute. Use a compression to ventilation ratio of 15 compressions and 2 ventilations. All right, so child CPR, the steps for child CPR are essentially the same for an adult. There are some variations to include the following. Use less force to compress the child's chest. In small children, use only one hand to depress the sternum, and we're going to be using less force to ventilate the child. Remember, it does not take as much ventilation for us to ventilate the child because we're adults. And child is defined as anybody that's greater than 1 year of age up to the onset of puberty, usually somewhere between 8 to 14 years old. All right, so the steps to administer: establish the lack of responsiveness and breathing, and remember, gasping is not appropriate. Check for circulation, for at least 5 seconds and no more than 10 seconds, and then provide chest compressions at a rate of 100 to 120 compressions per minute. Open the airway and then give 2 effective breaths. So people say, well, how do you tell that it's an effective breath? Well, that's easy. Look for chest rise. Okay, remember that when you're giving those breaths, it's not your full breath or your full tidal volume, or you're not going to breathe in tons of it. You just want to blow in enough rescue breath in order to see the chest rise. All right, so continue the cycles of compressions and ventilations, and then reassess the patient after 5 cycles of CPR and every 2 minutes thereafter. All right, so signs of effective CPR. It is important to know the signs of effective CPR so you can assess your efforts of resuscitation of any patient. Signs of effective CPR is as follows. A second rescuer feels a carotid pulse while you're compressing the chest, or the patient's skin color begins to improve from blue color to a pink color. And then, of course, chest visibly rises during ventilations. And compressions and ventilations are delivered with the appropriate rate and depth. Broken ribs. A lot of people go, oh my God, what if we break ribs? Well, it's better to have broken ribs and being alive than not to have CPR at all because you're afraid of breaking somebody's ribs. You may break a patient's ribs while delivering compressions. It just happens, okay? But they can be minimized. These complications can be minimized by doing proper technique, all right? To prevent this problem, use proper hand positioning and do not let your fingers come in contact with the ribs. If you hear a cracking sound, check and correct your hand position, but continue the CPR. Gastric distension. Gastric distension is caused when too much air is blown in too fast and too forcefully into the stomach. This means you're not keeping the airway open adequately. Gastric distension causes the abdomen to increase in size. A distended abdomen pushes up on the diaphragm and prevents the lungs from inflating fully. Gastric distension often causes regurgitation as well. If regurgitation occurs, quickly turn the patient on the side, wipe out the mouth with your gloved fingers, and then return the patient to the supine position. You can prevent gastric distension simply by making sure you have an open airway completely when you're doing your ventilation, and don't blow excessive amounts of air into the patient. All right, so like we mentioned earlier, regurgitation or vomiting, it's common during CPR, okay? It really, really is. To minimize the risk and minimize the amount of air that enters stomachs, you need to make sure that we respond quickly to this and keep their airway open and clear the airway out as much as possible. You can minimize that risk of regurgitation by minimizing the amount of air that goes into the stomach. When cardiac arrest occurs, the muscles that keep the food in the stomach begins to relax, so it allows the contents of the stomach to back up. If the patient regurgitates while you're performing CPR, just turn them over to their side, clear out their airway the best you can. And remember, in your EMR kit, you should have some kind of manual suction unit. You may even have a battery-powered suction unit, which is even better. So you need to clear it out as best as possible. So use that suction to your best advantage, and just plain and simply do your best. All right, if the airway is not cleared, 2 problems may arise. The patient may breathe or aspirate the vomitus into their lungs. This is bad. You also may force vomitus into the lungs with the next artificial ventilation. So as soon as you've cleared the vomitus, go ahead and start. So it's very, very important that you not cause either one of these when you do your ventilations. That's why we roll them to their side and get them all cleaned out as good as possible. All right, creating sufficient CPR or space for CPR. You do need space. If the patient is in a confined space, they're in a small area, you need to pull them out to an area that you can do effective CPR. I'll give you a perfect example of this. In the bathroom, if they go into cardiac arrest, we call this the old commode code. If they go into cardiac arrest in the bathroom, you need to remove them from the bathroom before you start. You just do not have enough room in there to be effective. So get them out of the bathroom, do a clothes drag, blanket drag, whatever you need to do to get them out of there. So you at least have a space 3 to 4 feet on all sides. Yeah, here's a perfect example. This is in a bathroom, and notice how they're using a clothes drag because this gentleman has his hands grasping the clothes to pull that person out of the bathroom. So if there's not enough space, you have two options, quickly rearrange the furniture or whatever, or drag them out, whatever works for you the best at the moment. All right, so early defibrillation. So let's talk a little bit about defibrillation. Defibrillation is when we're going to be using electricity utilizing an automated external defibrillator. More than 70%, okay, of out-of-hospital cardiac arrest patients need to be defibrillated, okay? Each year in the United States, approximately 424,000 people die of coronary heart disease in an out-of-hospital setting. That means that they're somewhere at home, they're at the grocery store, they're at the convenience store, they're driving in their car. More than 70% of those out-of-hospital cardiac arrest patients have that irregular heart rhythm that we were just talking about, ventricular fibrillation, VFib. This is a disorganized group of electricity that's running through the body that's just making it quiver. That is a rapid, disorganized, ineffective vibration of the heart, plain and simple. Electrical shock is applied to the heart in these cases. It's called defibrillation, and hopefully it reorganizes the vibrations into effective heartbeats. A patient in cardiac arrest stands the greatest chance for survival when early defibrillation is available. All right, so to get defibrillators to cardiac arrest patients more quickly, increasing the numbers of EMS systems are equipping first responders with automatic external defibrillators. This guy right here is a training model. This guy right here is a real life model, okay? So these machines accurately identify ventricular fibrillation, like we mentioned on the last slide, and advise the rescuer to deliver a shock. The first thing you do with these guys is turn it on, and it tells you what to do. That's the beauty of it. It walks you through the entire process. The links to the chain of survival include the following: recognition of cardiac arrest and activation of the EMS system, immediate CPR with emphasis on high quality chest compressions, and rapid defibrillation, okay? Then basic and advanced life support care, and then basic and advanced EMS life support care, and then advanced life support and post-arrest care at the hospital. So these figures show you automated defibrillators. They're wonderful. They're very easy to use. They walk you through the process. All right, so performing the automated external defibrillation, like I said, is easy. The steps for using AED are listed in Skill Drill 8-4, and many of them vary in their operation because they're different types. But the bottom line is it has to be turned on. Some you have to turn them on manually. Others, as soon as you lift the lid and open it up, it turns on automatically. CPR training, EMR should successfully complete a CPR course through a recognized agency, and then regularly update their skills by completing a recognized recertification course. Most recertification courses and most CPR courses are good for every 2 years. Your department should schedule periodic reviews of CPR theory and practice. Right, so legal implications of CPR. Oh my God, what's going on with this? Well, we do have some things that go on with when we do CPR, when we don't CPR. We mentioned earlier about a DNRO, so let's talk about it, our do not resuscitate order. Advanced directives such as living wills and durable powers of attorney for healthcare are legal documents that specify the patient's wishes regarding specific medical procedures. Because you are not in a position to determine whether the advance directive or living will is valid, CPR should be started on all patients unless signs of obvious death are present. If the patient has an advance directive or living will, the physician at the hospital will determine whether you should stop CPR. You will also be following whatever local protocols that you have in place at your department. Right, so do not hesitate to start CPR on a pulseless, non-breathing patient. Without your help, the patient will most certainly die. The chances of encountering legal problems are minimal if you perform a careful assessment of the patient before beginning CPR. Another potential legal pitfall is abandonment. Abandonment is the discontinuation of CPR without the order of a licensed physician or without turning the patient over to someone who is at least as qualified as you are. Your most important protection against possible legal suits is to become thoroughly proficient in the theory and the practice of CPR. All right, so let's summarize. Cardiac arrest occurs when the heart stops contracting and no blood is pumped through the blood vessels. Each beat of the heart produces a pulse, which can be felt at various sites of the body, such as inside the wrist, which is the radial, the neck, which is the carotid, and the upper arm, which is the brachial, and the groin, which is the femoral. Cardiac arrest occurs when the heart stops, like we just mentioned, and is not pumping blood. And that brain damage is caused or begins within the first 4 to 6 minutes after the patient has experienced cardiac arrest. Within 8 to 10 minutes, the damage to the brain may become irreversible. The chain of survival is the recognition and activation of EMS, immediate high-quality CPR, and rapid defibrillation, and then basic and advanced EMS care, and then finally ALS and post-arrest care in the hospital. And all this includes steps that are essential for the patient for successful cardiac arrest care. When you arrive at the emergency scene, you must first assess the area for potential safety hazards. If the scene is unsafe, make it as safe as possible for yourself and the patient. As you approach the patient, look for possible causes of illness and injury. Next, assess the patient by checking for responsiveness utilizing the CAB process: circulation, airway, and breathing. All right, so if the patient is not breathing, you must breathe for him or her, check for a pulse. If it is absent, begin CPR. Basic life support for adults and children follow the same general steps. Check for responsiveness, airway, breathing, and circulation. Intervene at any point where the patient's airway is obstructed, the patient is not breathing, or the patient has no circulation. Open an infant's airway by using the head tilt chin lift maneuver if you do not suspect spinal injury. Be careful not to hyperextend the neck, otherwise you're not going to breathe for them. You're going to actually obstruct their airway. If the infant is not breathing, provide 2 initial breaths. Look for chest rise. Okay, that's the way you can tell that it's working or not. If that doesn't work, reposition the head and do it again. If the breaths produce visible chest rise, check for a brachial pulse. If an infant does not have a pulse, or if the pulse rate less than 60 beats per minute with poor perfusion, begin CPR. So let's be clear on that. If you feel a pulse and it's running at about 30 or 40 and they look very pale, you're going to start CPR. If you're alone, you're going to use 2 fingers to compress the chest 30 times at a rate of 100 to 100 chest compressions per minute, to a depth equal to at least 1/3 of the depth of the chest, approximately 1.5 inches on infants, 2 inches on children. After the 30 compressions, give 2 breaths. If 2 rescuers are present, use the 2-thumb technique with the hands encircling the chest and provide 15 compressions and 2 breaths. Remember, that's the old 2-thumb chest, 2-thumb encircling technique that you're going to use when you have 2 rescuers on an infant only. All right, the single most important cardiac arrest survival factor is early defibrillation. The indication for using an automated external defibrillator are the patient is unresponsive, there's no breaths, and they have no pulses. All right, finally, once turned on, attached to the patient's bare chest, the AED will analyze the heart rhythm and advise whether a shock is indicated. If a shock is advised, ensure that no one is touching the patient and deliver the shock, and immediately perform CPR for 2 minutes before reanalyzing the patient's rhythm. If no shock is advised, perform CPR for 2 minutes and then reanalyze the patient's rhythm. Continue CPR and rhythm analysis until ALS personnel arrive. Bottom line is that the AED machine counts those 2 minutes for you. It also gives you a beep, 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 beep cadence on how to do CPR. I'm telling you folks, you wait till you do your skill drills. You're going to love it. This is not difficult at all. Once you learn the sequences and you memorize, when you're by yourself, it's always 30 compressions and 2 ventilations, period. If there's 2 people, okay, or more, and it's an infant or a child, it's 15 compressions and 2 ventilations. And get that AED as soon as possible. Okay, early defibrillation is the key. Early defibrillation is the key. And follow the prompts. The first thing to do is to turn it on. All right, very good. Pretty long lecture there, but that's okay. We're about 40 minutes into it, 41 minutes. Congratulations on getting to the end of this. So again, what's next? Go back to your JBL Navigate dashboard. Go to the assessment block. Open the chapter assessment for this lecture. Complete the assessment and submit it. You may take the assessment as many times as you like. You must achieve 70% or higher with a cumulative score for each chapter. All right, thanks. Appreciate it. Good stuff. If you have any questions, be sure to email your instructor. This is the best way to get your information. You can email us at student@emets.net. We'll get back with you in 48 hours. All right, have a good one. It's been lovely. We'll see you next time.